my name is Elle De La Cruz. I'm with the broker's office with Levitt and Touche or Marsh McLennan Agency. So we work with you guys each year. We work with the admin team at Guthrie and all to make sure you have the best benefits package available to you. So I know I want to respect everybody's time, and I'm just going to walk through what the benefits are for the new plan year. There's not any major changes, but I just want to make sure everyone knows what you need to do and then what's available for you. So I'm going to be walking through the benefits guide for you guys for the 2023-2024 plan year. And so it'll look very familiar if you've seen the one from the prior year. It just kind of starts off telling you your table of contents, and then it'll walk you through the different sections. So just the first part here is just your eligibility and enrollment. So letting you know who is eligible for benefits. So all full-time all full-time employees are eligible for the benefits offered, including medical, first of the month following 60 days from your date of hire. If you are a part-time employee, then you are eligible for benefits for the dental, vision, and life benefits, not the medical, first of the month following 60 days from date of hire. Each year, you guys have the opportunity to enroll in benefits through your annual open enrollment. So this is something that is set in place and it's regulated by the IRS because of the fact that your benefit deductions, what you're paying for your benefits out of your paychecks, are taken on a pre-tax basis. For that reason, they limit how many times you can make changes to your benefits. So you are allowed an annual open enrollment each year. So all employees will need to log in and make their benefit elections, whether you are waiving or enrolling in coverage for the 2023 to 2024 plan year. The portal is open for that, and it is open through November 3rd. So we are just encouraging and asking that everyone make sure they complete that by that November 3rd deadline. And as I mentioned, it is when you can make changes to your coverage, it is regulated by the IRS because of those deductions being pre-tax. So that means what you elect during open enrollment, you are committing to for the duration of the plan year, unless you have what the IRS recognizes as a qualified life event. So examples would be marriage or divorce. We have some listed here: birth or adoption of a child. If you lose coverage, so if you lose or gain coverage, that's also a qualified life event. You do need to notify your HR team, though, very quickly. You need to notify within 30 days of that life event date so that you can make changes to your coverage. If you do not notify them within 30 days, then what happens is you either are going to have to wait until the next annual open enrollment to make changes to coverage or another life event. So whichever one was to come first. So just knowing that 30 days is really important, making sure that you are reaching out right away. All right, and we'll talk through the medical plans that are being offered. So the first part here is just talking through the two different plan types that you guys have available to you. One is a PPO option, one is a high deductible health plan. A PPO is your preferred provider organization. These plans you'll typically see co-pays for certain services, usually your like urgent care, primary care provider, if you're seeing a specialist, if you're picking up prescriptions. The other option is the high deductible health plan, and the plan is structured differently because you don't see copays on this type of medical plan. You are actually paying for your services at the contracted in-network rate with the providers until you reach your deductible. And then co-insurance, which we'll talk about, kicks in after that. There are advantages to a high deductible health plan, especially tax advantages because of the health savings account option, which we'll discuss as well. Before I jump into the plan designs, these are just a couple of tools we like to point out for you guys that you have access to if you're enrolled in the medical plans. One is the Blue Cross Blue Shield mobile app. And this app is very helpful in terms of if you're looking for providers, if you've misplaced your ID card and you're needing to get to see a doctor on a weekend, late in the day, you can just pull it right up on the mobile app. Some people don't even carry anymore because of all of our access to smartphones, don't even really carry their physical cards too often anymore, and they just access it electronically this way. Also an option. I personally like their desktop version for azblue.com as far as doing some more detailed searches when looking for providers or using that cost estimate tool. But everyone, once you are registered with Blue Cross Blue Shield, you will have your own unique login. And what that does is it ties to the plan that you've enrolled in. So when you're searching for providers or you're searching for cost estimates for providers or services, it's going to go based on the plan you elected to give you those resources and show you what's available. However, if you are not currently enrolled in the plans or you're looking at enrolling in a different plan or network for the new plan year, then you'll just want to search as a guest under azblue.com, because you're going to then want to differentiate between the two networks we're going to talk about here in just a moment. This one here is just prescription drug benefits. This is just letting you guys know, it's just more informational vocabulary on what a pharmacy formulary, how it works. Typically, you'll see different tiers for different medications that fall under the formulary with an insurance provider. Tier 1 is typically your generic formulary medications. Tier 2 would be your brand name. Tier 3 is like a non-formulary prescription. And then Tier 4 gets into more specialty prescriptions. Specialty prescriptions usually require either more unique like handling, either refrigeration, or they're considered injectable, things like that. And then this one here is for your telehealth services. So this is available under your plan or under your plans. So regardless of the plan you elect, you have access to telehealth services through Blue Cross Blue Shield. The vendor they utilize is called Blue Care Anywhere. And so what I always recommend doing is once you are enrolled with Blue Cross Blue Shield, once you have an ID number, is to go on to that telehealth app, that Blue Care Anywhere app. It's a separate app from AZ Blue, and just register and have it set up and ready to go. This way that if a time comes in the future that you need to actually get connected with a virtual provider, you're not having to go through the whole process of setting up this app while you're feeling sick and just needing to talk to someone. Once that information's in there, it's going to pop up when you go to use it, asking you just to confirm and then give you the option to connect with a provider. So it's really quick and it's really easy to do. It's just not a fun process to do if you're already not feeling well. So just having it ready to go is what I typically recommend. All right, so we'll talk through the plan designs here. So the first two plans, or plan designs, I should say, that I'm going to talk through are the two PPO plans. Encompassed on this page, though, is technically four options. There's a PPO 5,000 plan that is offered to you guys in either the statewide or the alliance network with Blue Cross Blue Shield. Same with the PPO 3,000 plan. So these two networks, they are different. So the alliance network with Blue Cross Blue Shield, it is a more narrow network of providers. I personally still think that that network is pretty big for Maricopa County because it is including some of those major hospital groups like the Banner Honor Health providers. And so as long as your providers are in network with that alliance network, there is opportunity for cost savings on your payroll deductions. So if you're in the statewide network and your providers you're currently seeing and you're happy with them are in the alliance network, it's something that might be worth looking into to see if you would be able to switch to that alliance network for those cost savings. So that's just a thought I like to throw out there because you'd be surprised how many providers are actually in that alliance network. Otherwise, that statewide network is the full network of providers. So it's a larger network within Blue Cross Blue Shield of providers that you have access to. So one thing I do recommend with either of these plans, whether you're looking at the 5,000 or the 3,000, or as we get to the high deductible health plans as well, is if you are not currently enrolled with Blue Cross Blue Shield and you're looking to find out if your provider is in network, you can either search the providers with these networks on azblue.com, or you can give them a call and ask them. But when you call your providers, and I always recommend saying the word contracted, whether you're finding out about medical, dental, or vision providers being in network, if you call them, say, are you contracted? Are you contracted with Blue Cross Blue Shield's Alliance network? Are you contracted with Blue Cross Blue Shield's statewide network? What I often have seen happen, and I actually experienced this many years ago before I was even working in insurance, is if you say, do you take, they are very quick to say, yes, we take the insurance, but they may be billing it out of network. When you are using an in-network provider, Blue Cross Blue Shield holds a contract with that provider. You're going off of their contracted rates. So everything is being processed at a contracted rate. When you are going out of network, there is no contract in place. So there's not a contract limiting what that provider can charge you for the visit. So if you were to go see an out of network provider and they submit that claim, it gets processed. And then you could be getting balance billed. So the difference of what Blue Cross Blue Shield would recognize as like the appropriate amount for that visit and what that provider charges you, you could be responsible for that whole amount, where only a small portion of that is even being applied towards an out-of-network deductible if applicable. So in network is just one of those things where you really want to make sure that you are verifying your providers are in network when you're scheduling appointments or ahead of time when making your plan selections. So between these two plans, they're very similar as far as you have copays for the services, or for several of the services, you have copays for the prescriptions. However, your deductible is going to be different. So on that 5,000 plan, you would have a $5,000 individual deductible or a $10,000 family deductible. So what that means is if you are an individual enrolled in the plan, you would have $5,000 that you would be responsible for services where the deductible applies before Blue Cross Blue Shield is going to kick in a cost share, what is called co-insurance on the plan. So on these plans where you would typically see your deductible come into play is if you went into the emergency room and they determined that you needed to be admitted to the hospital and you're going to have a hospital stay. If you're having an outpatient surgery scheduled, those are where you will normally see the deductible come into play. So the way that this would work is that if you were to have a hospitalization, you're going to be responsible for that first $5,000, which is your deductible on the plan. And then once that deductible is met, you would pay 30% after the deductible is met. Blue Cross Blue Shield would pay the other 70% until you reach the out-of-pocket maximum on there. So again, when you're staying in network, those costs, all of those services, they are being processed at a contracted rate, an in-network rate. So you can hit with a hospital stay, you could hit a $5,000 deductible. But because your plan and you're using in-network providers, because your plan has a $6,600 out-of-pocket maximum, that's the maximum you would be responsible for the year. And then after that is met, then you would be covered 100% for the remainder of the year by Blue Cross Blue Shield, as long as you continue to see in-network providers. For the family coverage, that deductible is multiplied by 2, and same thing with that out-of-pocket maximum. So what that means is if you were to have you and a spouse or you and a child enrolled in the plan, you would each have your own deductible and each have your own out-of-pocket max. If you were to have, let's say that you had a spouse and you had 3 kids enrolled in the plan, your deductible is still going to cap out at the $10,000 for family and $13,200 for family on the out-of-pocket maximum. So you could either have 3 people in your family reach that second deductible, or maybe just you and one other person each reach the deductible in the family, but then you would all be covered for the year after it's reached. It's not, you don't typically see a family deductible get hit. It's just that max protection. So it just depends on everyone's circumstances. For primary care doctor, if you were to see a primary care doctor, it's a $25 copay or $75 copay for a specialist. And then for your prescriptions, you're going to, depending on the tier that the prescriptions fall into, $15 is your tier 1. Generics are typically going to be the least expensive option if a generic is available. And then tier 2, tier 3, tier 4, the cost will go up a little bit there per month. There is cost savings too on these plans if you utilize the mail order pharmacy. So the mail order, it's really designed for for anyone that's on like a maintenance medication. So things like blood pressure medications or a medication that you know that you take regularly and that you're going to get filled each month. When the mail order is an option, they encourage you to set that up. And what they do is they basically say, instead of paying $15 per month at the retail pharmacy picking up your prescription, if you order a 90-day supply and have it delivered to you, we're going to charge you just 2 copays for that 90 days. So you have a little bit of savings doing it that way. Sometimes it makes sense for the convenience factor as well, just not having to make that trip to the pharmacy each month. The PPO 3000 plans, so again, this one, it is structured similarly, but you do have a lower deductible on it. So if you were to have like a hospital stay or an outpatient surgery, for example, you would be responsible for that first 3,000 before the co-insurance of 70% from Blue Cross Blue Shield, 30% from you would kick in up to your out-of-pocket maximum on the plan. Your out-of-pocket maximum on the plan, it does include that deductible. So if you were to reach the deductible, you're not having to meet an additional $6,350. That deductible is factored into that out-of-pocket max. You would have a $25 copay for primary care visits, and the specialist copay would be $60. Where we have diagnostic and x-ray listed on here, it just depends on where it's done. So when you have labs done at your provider's office, like your physician's office, and they're billing it through the office, it's going to be covered under your copay, your office visit copay. If you're going to a freestanding lab is where you're going to see that co-insurance and deductible apply. So, and again, contracted rates. So always important making sure that you're staying in network so that you're getting a better cost for those services. The complex diagnostics, MRI, CAT scans, it's a $300 copay. Cryo services are $75 on the $5,000 or $60 on the $3,000 plan. Urgent care, you guys do have a copay on these plans as well, so $75 on the $5,000 or $60 on the $3,000. Emergency room, the copay is there. It is a higher copay. Emergency rooms are they are going to be your highest cost option in general, and that's because they're really equipped for like life or death situations. And so anytime you go to the emergency room, it is going to be a more expensive visit. So if you can utilize that telehealth, if you can utilize urgent care or your primary care physician during like the normal office hours, those are going to be your first routes of care to save money. All right, and then these are the two plan designs that are compatible with a health savings account. So they're called high deductible health plans. So different from a PPO. On a high deductible health plan, you're not going to see any copays for your services. You would still have access to the Blue Care and more telehealth, but it's going to be, instead of having like no cost for that, there is generally about a $59 to $69 cost that I see when using a high deductible health plan, which is it's still a great price for using that because you are using that contracted tool that they have for you. But the reason that high deductible health plans are structured this way is because they have that compatibility with the health savings account, which gives you guys the opportunity for a tax advantage there. So with the health savings or with the high deductible health plan, when you go to your doctor, when you go to, if you were to get admitted to the hospital, if you were to pick up a prescription, go to urgent care, any of those services, it's all going to be processed at the in-network contracted rate as long as you're using in-network providers, and you're going to pay for those services at that rate. So as we talk about the health savings account, it'll help with seeing how you can build money in the health savings account to pay for those expenses as they come. But the IRS, because that health savings account has tax advantages, they will not allow what's called dollar first coverage, meaning they do not allow copays on these types of plans. So on the health savings or on this high deductible health plan 6,000 plan, if you were to reach your $6,000 deductible, you would have 10% co-insurance after the deductible is met. And then you would be, once you reach that would go to the $7,000 out-of-pocket max. And when you reach that, you would be covered for the year. So it is a higher deductible upfront, but that is how this plan would work. On the high deductible health plan 4,000, you have a lower deductible option, but it's going to be structured the same way. So if you need that $4,000 deductible, then you would pay 10% co-insurance after the deductible is reached up to your $6,000 out-of-pocket max. So the high deductible health plans, they're great tools, and I've seen them be very popular for two even varying scenarios. Somebody who doesn't maybe go to the doctor very often just wants to have a plan option where they have their insurance in place. It protects them in like a worst case scenario, or as they have maybe a few things that come up throughout the year, and they're able to build money into this health savings account for a time that maybe something does come up down the road. The other side of it I've seen is someone take the high deductible health plan because they know that they're going to reach their deductible. At least maybe some of their out of pocket for the year. Maybe they have a scheduled surgery. Maybe they have a medical condition where it requires a lot of like medications, testing, things like that for maintaining throughout the year. And then they're able to fund that health savings account for the year so that they can be able to pay for those expenses. So there's a couple of different ways that this can be a useful tool, especially if you have experience with it or you understand how it works. The other thing too, I really encourage with high deductible health plans is that when you're scheduling services, so if you're asked to have an MRI done, if you're looking for a specialist provider, that cost estimator tool on easyblue.com when you're registered will be your best friend. Because when you're searching for providers, you're going to get an idea of what the cost will be for the provider you're selecting. I've seen cases where an MRI cost it can vary by several $100s. So the provider might say, hey, go to this place, it's in the plaza, it's in network, it's fine, you can go get your MRI done. But if you were to research, you might find somewhere 3-4 miles down the road that maybe isn't as big of a name, but you might save $400 on it. But that's money that you are spending, that's money you're paying out of your HSA. So finding that better contracted rate is money that's going to help, or it's what's going to help keep money in your pocket. So there's definitely some useful tools that we want to make sure you guys are aware of. So this next part will lead us into the spending accounts. So the HSA bank account, this is the one that is compatible with those high deductible health plans. So if you enroll in a high deductible health plan through Guthrie, you guys have the option to contribute money to a health savings account. In order to help you guys with those expenses that you will be having through the high deductible health plan, if you were to see providers and all, Guthrie is giving you guys a contribution of $500 for the year towards your HSA bank account. That's a very generous contribution for you guys. And that's something that helps you guys be able to have money accruing in your account to help you get started as you go through the year on the plan too. So anything that you can contribute over that is just going to help you have money on hand when expenses do come your way for the cover or through the plan. So with a high deductible health plan, you own the HSA bank account. So it's going to be a separate from your insurance piece. Your high deductible health plan, you would have your Blue Cross Blue Shield insurance card. Your health savings account, you're going to get a debit card in the mail. So as that account's being funded, you're able to track the balance and use those funds to be able to pay for your medical expenses. It does need to be used for qualified medical expenses. So, and we'll talk a little bit about that here in a few minutes, but the money it also with the health savings account, it does roll over every year. So it is not a use it or lose it provision. So if anyone's ever had experience with an FSA before, it is different. The two often do get confused with each other because FSAs have a use it or lose it, and the HSA, your health savings account, does not. You're choosing how much to contribute. It does need to be within the IRS guidelines. So if you are looking to contribute to your health savings account, we're going to talk about what those limits are. And then it has to be paired with a high deductible health plan. So this is important because if you are enrolled, let's say that you were enrolled with a spouse through another employer, or you're on a parent's plan still through another employer and they have a PPO plan, you cannot be enrolled in a PPO plan either with Guthrie or someone else or somewhere else and enroll in a high deductible health plan and contribute to an HSA bank account, because that would then be considered that dollar first coverage, which the IRS will not allow for a health savings account for that tax advantage. And so if you are contributing to one, you are pairing it with the high deductible health plan, you are receiving a tax advantage. So the way that tax advantage works is you are paying, so you're contributing to that health savings account pre-tax from your paychecks. So you're not being taxed on the money that's taken out and contributed to that account to be able to pay for your medical expenses. And then when you're going to file your taxes the next year, so when you go to file, let's say you put $3,000 in the health savings account for 2023, and you're going to file your taxes early next year for 2023, your taxable income is lowered by that $3,000 you had contributed to the health savings account. So you're not being taxed on that money. It's just that money going into the health savings account can only be used for medical expenses. And with medical, when we say medical expenses, that also does apply to dental and vision. So we haven't quite jumped into those benefits yet, but if you do have dental and vision expenses, you can use your HSA funds for those as well. So with the HSA, it is able to grow on a tax-free basis. Typically with HSA bank accounts, once you get a certain amount in the account, depending on the bank, so depending on what Bank of America's limits are and all, you guys have the option to be able to start investing some of your money as well. So there is some opportunity there for the money to grow and be invested. The limits though for 2024 is, so the IRS is limiting for employee only. So if you were enrolled by yourself in the high deductible health plan, the maximum amount you can contribute is $4,150 for 2024. That does include the contribution you're getting from Guthrie. So that's just something to keep in mind as well. family coverage. And so for the purpose of an HSA, that means you and at least one dependent. So you and a spouse, you and a child, or you and spouse and children can contribute up to $8,300 for the year into that health savings account. As I said, it has to be used for qualified medical expenses. And what happens is very similar to like if you were to withdraw from a 401k early. If you were to pull money out of the health savings account for non-medical, non-qualified medical expenses, then that money does get taxed at normal income tax. And then what would happen there is you would also have an excise penalty tax. So very similar to if you were to withdraw from a 401k early. So it's just something to keep in mind. There are a lot of different qualified health expenses, like medical expenses, for using your HSA bank account. These are just things that we want to make sure you have in the back of your mind when you're using your funds. If you visit the website hsastore.com, you'll see a whole list of eligible items. A lot of retailers now too, when you look online, I believe Amazon, Walgreens, there's several, they'll put HSA eligible or FSA eligible, like you'll say HSA, FSA eligible next to the items that you're purchasing. So that way you're able to utilize your funds toward it. All right, so the next one here jumping into is going to be your dental plans for 2023-2024 plan year. So you guys are going to have the same two plan options available to you for this new plan year. So if you are already enrolled in the plans and the one you're in is working great for you, then that's great. You don't need to make any changes to it. You would just re-enroll in it for the new plan year. But the way that these plans work is you have a dental PPO plan that has the $50, that's your first plan shown here on the left side, has a $50 individual deductible, $150 for family. So whether you have 3 family members enrolled in the plan or you have 5, it caps out at $150 deductible. Each enrolled family member would have a $1,500 annual maximum on the plan. And then preventive care, that's your annual cleanings that are done twice a year. They are covered at 100% for the those annual cleanings are covered at 100%. It's every 6 months, so you get it twice a year, and that includes x-rays one time during the year. So that is going to be for that dental PPO plan. If you look at the prime PPO, it says scheduled copays, and that's because that plan goes off of a set schedule of costs for the services you're receiving in the plan's network. So making sure that you're finding in-network providers. Under the dental PPO plan, the way that this one is going to work is, let's say you had your exam done and they determine that you have 2 fillings that need to be done. The way that those are going to work is it's going to be processed at the basic services. So that means you'd pay your $50 deductible and then 20% of the in-network amount for those fillings being completed. Major services, that's going to get into more major dental work, usually root canals. If you're having like periodontal endodontic type work done, then that's going to fall into the major services of 50% after deductible. Also, usually you'll see like crowns, those types of services. Orthodontia, it's going to be 50% up to $1,000 benefit for children up to the age of 19. So the orthodontia benefit on the plan that is for children, it does cap out at age 19, and it is considered a lifetime maximum. So if you had a child who had ortho done under this plan this year, the benefit would not reset for them for next year. So that's only going to be the one-time lifetime limit on ortho. The dental prime PPO is just going to be each of the services. You'll have a $25 copay for an individual, $75 for family. It is a different dental network, so you just want to make sure you're finding a dentist in the dental prime PPO network. And then again, each of those services you have done are going to be at a fixed contracted rate for them. All right, so jumping into the vision plan, there is a change here that I just want to make sure I note for you guys. On the vision plan, you guys previously had it through VSP. So this current plan year you're in, it's through VSP independently. So your plan, like your group number, your plan summary, and it's all produced and given to you by VSP. Well, for effective December 1st, it's going to still be a VSP network plan, but it's going to be under Equitable, which is part of Blue Cross Blue Shield. So if you were wanting to have to log into your Equitable portal to see like your vision benefits, your life benefits, you're going to log into that VS, or you're going to log in and register under that equitable portal for that. However, for finding providers, or if you go to your vision provider, you have one, you're already, let's say you're already enrolled in the vision plan, you have a provider you're not changing the network. So you would still be able to use those providers in that VSP network. If they ask you who your insurance is through when you go to the eye doctor, you're going to say it's through the VSP network. So you can say it's through Equitable, but what they need to know is that it's the VSP network, because that's who they're calling to verify your benefits. So, and we have the group number at the back of the benefit guide for you as well if you were to need that. But generally with vision, you don't even get ID cards anymore. They just tell you that they really just need your social security number, date of birth, and that's pretty much how they'll call in and verify it with VSP. Same thing for dependents. If you have dependents enrolled on your plan, it's all going to be verified through you as the subscriber. So it's your birth date and your social security number. The vision plan, it gives you a $10 copay for your exam every 12 months. If you were to get glasses, so your frames and lenses, it's a $25 copay for lenses, $130 allowance towards the frames. I do like to just talk about this one just a little bit, just because I feel like vision can be a little tricky, because for those of us that wear glasses, I wear glasses and contacts. I'm not sure if you've ever gone to have your vision exam done, you went to purchase your glasses, and you find out it's more than just that $25 copay you were expecting for the lenses. What typically happens with those lenses is, because when you're looking at a $25 copay, that's generally just those basic lenses. They don't include any of the enhancements, they don't have the upgrades listed, and they're usually available like under a certain prescription. So like I believe it's like under 3, like plus or minus 3. Anytime you get over that number in a prescription, you have a heavier prescription, which generally can make those lenses a little more difficult to get into a format that's going to be good for your eyes, like your vision and all. So they start moving them into what's called a higher index lens, so that you don't have these really thick lenses. And those higher index lenses typically have those certain features built into them. That's like your blue light filter, your anti-glare coating, scratch resistant coating, those types of things. So there is added cost. That's where that usually comes from for those lenses to have those features. But because you have vision insurance, you're still seeing a discount for them versus what they would cost without the insurance. So it's something just to keep in mind, just so you're aware of that if you were to go get glasses. I just don't want anyone to be caught off guard. Again, you can use HSA funds towards your glasses. You can use them towards dental expenses as well. So if you are enrolled in that health savings account and contributing. If you wear contacts, you can get the contacts instead of the frames and lenses. So it is a $130 allowance towards those. The insurance, vision insurance plans only allow one or the other though for the year. So if you were to get frames and lenses next year, then you wouldn't be able to get contacts in the same year. So for me, I get my frames and lenses every other year. It's really what I used to do, because I don't feel like I need to update my frames as much, because my glasses prescription doesn't change dramatically each year, but I wear contacts regularly. So I will usually use my allowance for my contacts. And I've seen some people just choose to use like the allowance for one or the other, and then go to like Costco or Sam's Club to get wholesale pricing on the other one. So there's some options for that, but I just like to point that out because the insurance does limit you to being able to do one or the other for the year. Okay, so I'm going to jump into the life and AD&D benefits. So employees of Guthrie Mainstream Services, you guys do have a basic life insurance benefit of $25,000 provided to you. So that means that each employee has this benefit paid for by Guthrie. So this is a really nice benefit to have. So the reason that we also ask you to log in and do your benefit elections each year is we want to make sure all of your information is up to date. Your dependents information, your beneficiary information. As morbid as that sounds, the beneficiaries, it is really important that those are looked at regularly. There's been circumstances where people have had major life event changes. They've gotten divorced, remarried, they've had children, and haven't touched beneficiaries in 10 years. So you want to make sure that who you guys have listed is who you want listed in the system. For voluntary life and AD&D, this is optional coverage for you to purchase. It's optional term life that can be purchased through the group insurance plan. However, a couple things I just want to note on this is if you are a new hire first becoming eligible for benefits. So your first effective date based on your date of hire is going to be like November 1st or December 1st. Or after. That first time you are offered this coverage, you can elect up to what is called a guarantee issue amount on the life insurance with no questions asked. So for employees, you can elect increments of 10,000 up to 300,000, but up to 150,000 would be no questions asked if you are a new hire being offered the coverage for the first time. If you are not a new hire, so you've previously declined the coverage or you've previously enrolled in it and are wanting to increase the coverage, you can still apply to do that, but it is subject to underwriting approval through what's called evidence of insurability form, and which is essentially like a medical questionnaire that goes through underwriting to be able to apply for and get the coverage. If you enroll in coverage for your spouse, you can elect increments of 5,000 up to 150,000. 25,000 of that would be guarantee issue if you're a new hire becoming eligible for the first time. For children, it's increments of 5,000 up to a $25,000 maximum. All right, and then again, just to reiterate, I just want to make sure everybody knows if you are currently enrolled or you've declined it in the past and are wanting to enroll or increase, that you do make sure to submit an evidence of insurability form for that. When those are submitted and reviewed by the insurance carrier, if approved, the coverage typically goes into effect the first of the month following the date of approval. All right, and this next slide here is just the employee assistance program. So this is something that is available to you guys, and it's provided through Equitable, through having your basic life coverage through them. And what this is it's a confidential resource that's available to you guys and members of your household. So everyone has things that happen in their life. They experience them differently. We cope with things differently. And this is designed to be in place for you and your household dependents to be able to have someone to reach out to that is a confidential person that you are not going to be, this information doesn't get fed to us. It doesn't get fed to Guthrie. No one would know about it, but it allows you or your dependents to be able to talk to someone. When you call in and talk to somebody, what they can do is they can give you either telephonic sessions. So you would get 3 free sessions per incident per year, or they could place you with somebody face to face. So when you call in, it is free to have this service, but it is not uncommon for them to ask you if you have insurance and who your insurance provider is. The reason they do that is not because they're looking to bill the insurance provider. It's because if you're being placed with a counselor, like a licensed counselor, they want to try to find somebody in your insurance network in case you were to want to continue to see someone beyond those 3 visits. So it's just something to keep in mind. They're not looking to bill the insurance, but they may ask you for your insurance info for that reason. And then this next section here is just going to be your legal services and your identity theft coverages that are available to you. These are employee paid benefits, so they are voluntary. It is something that you have the option to consider. If you've currently enrolled in it, you can just continue it for the next year, or if you haven't enrolled in it before, but it's something you're interested in. Legal services is designed to help you with a network of attorneys where you're basically able to get connected with somebody to get assistance with legal matters. Depending on what it is that you're needing that guidance on, you'll find like heavily discounted rates to be able to work with those attorneys on those situations. The identity theft is separate. So identity theft protection, this is more your credit monitoring. So trying to protect you from something happening. And then if something was to happen, so you log in and you check your credit file 6 months from now and you're enrolled in identity theft and you find that there's a loan on your credit file that you never opened, you never authorized or anything, this is where they are designed to step in and help. So help you navigate that process and the time and work that goes into that. Navigating identity theft can take hours and hours, if not weeks and months, to get sorted out, depending on the severity of what's going on. So having a resource that's available to you, that's a big thing, especially with so much technology we have today with the data breaches we hear about and things like that. These are things that are good to consider just to have in the back of your mind as you're weighing your benefit options. All right, so this page here, this is just going to be your cost breakdown. So I'm just going to explain how this works. So the very top plan, it's going to start with your PPO $5,000 plan, and it's going to be the Alliance Network first, followed by that statewide network. Again, the Alliance Network, that's a more narrow network of providers. However, if your providers are currently in that network, then you could possibly have cost savings if you're currently in the statewide network by switching to Alliance. Again, we just want to make sure you're finding in-network providers, depending on the plan you elect. And then the next one there's what's going to show that statewide, followed by the 3,000 Alliance, and then the 3,000 statewide plan. And then you'll see your two HSA plans, so those high deductible health insurance plans that are compatible with the health savings account. Those plans are both only offered in the statewide network. So you're not going to see an Alliance network option for those. So those would be the full network of providers. And for the medical, so your benefits are shown per, or your deductions here are shown per pay period, so semi-monthly. And you guys do receive a contribution for the medical from Guthrie of $325 per pay period for your medical insurance. So you guys have a really great benefit package available to you with quite a few options to choose from. For the dental, you guys have the two dental plans listed. That Prime PPO is going to be listed first, followed by that dental PPO plan. The Prime PPO, it is a different network from the dental PPO, so there is opportunity for cost savings if you're okay there with the scheduled co-pays and able to find your dentist in the Prime network or switch to one in the Prime network. And you guys do have a contribution from Guthrie on the dental as well that helps bring the cost of those coverages down for you. And then the vision PPO plan, that is going to be that's going to be your vision coverage through the VSP network, but equitable for the new plan year. And then this page here is just going to switch over and show you guys the directory and resources. So this is just who to contact in the event that you needed some information on something. If you were to have a complex like claim situation, I do recommend that you guys either reach out to us. We have a claims advocate, or if you reach out to your HR team and they reach out to us. I know sometimes claims can be more of a personal situation. So if it is something that is very complex, we include the information for our claims advocate here at the bottom of this. And what she does is she steps in and helps navigate that on your behalf. So if you're receiving bills in the mail that aren't making sense, like you had a hospital stay and it looks like something was billed incorrectly, or it looks like it was, it's not adding up. This is where she's designed to really be able to step in and help navigate that for you. So being able to work through that with the insurance carriers and the providers, so that you guys aren't having to be held in the middle of that and get on the phone and keep telling your story to different people with 1-800 numbers. So just something we want to make sure you guys are aware of. All right, and then these next pages are just going to jump into the notices. I'm not going to walk you guys through each of these. This is more like nighttime reading if you can't sleep, but it's going to be like your Medicare Part D notice and disclosures that are available for you to have access to as well.